Hello, I'm Mark Bayshore, and welcome back to Relaunch Greater Lansing's Trusted Voices interview series, where we are talking with leaders in healthcare, business, education, and government about the importance of getting the COVID vaccine. Our guest today, Dr. Farhan Badi, CEO and Chief Medical Officer at Carefree Medical, providing care in Lansing to those who otherwise would go without it. Dr. Badi, many thanks for joining us to have this important discussion today.
Thank you. My pleasure.
To begin with, what can you tell us about the safety of the COVID vaccines?
Well, what I can say is that these vaccines have been proven to be especially safe. When you look at these vaccines compared to other vaccines that are on the market, the data is really, really compelling. I know that the public may have some concerns, which we're going to get into, but just the raw numbers, the 40,000 participants that were in the Pfizer and the Moderna studies, that data showed that the vaccine was very safe, that nobody that got the vaccine contracted the disease and then needed hospitalization and death. And moreover, that the rare blood clots that were affiliated with the Johnson & Johnson vaccine potentially, that was 20 people out of 8 million. And when you compare that to the disease itself, when you look at COVID-19, for every 1 million people that get COVID-19, that same blood clot in the brain happens about 40 times. So when you compare 40 people out of 1 million compared to 20 people out of 8 million, so that's 16 times higher risk of getting that blood clot in your brain if you contract the disease versus if you get the Johnson & Johnson vaccine. And all three of the vaccines that we have here in the United States have essentially a 100% reduction in hospitalizations and deaths from COVID-19.
Talk to me about what kind of concerns you're hearing most about from your patients, and why do you feel vaccines are particularly important for the people you are serving?
So I'll answer the second part first. So vaccines are so important because we need to reach a certain level of community immunity, or what we call herd immunity, because the virus can't mutate if it can't replicate. What does that mean? That means that if we stop the replication of the virus, or in other words, the person-to-person spread of the virus, then the virus will have less opportunities to create new mutations as it spreads from person to person. And so we need to stop that viral replication process. And the only way to do that is what we're doing now, which is trying to immunize as many people as possible. And the target is at least 80 to 85% of the public needs to be vaccinated. And then, in the meantime, while we're waiting to get vaccines up to that threshold, that's where, the public health measures come into play with the distancing and the mask wearing and the hygiene, et cetera. For the first part of the question, I think that the two biggest things that I hear from my patients are questions about safety, because they think that maybe it was rushed to the market and they didn't have enough time to quote unquote research this. And then unfortunately, the other concern that I hear from patients is that, well, COVID-19 isn't really that big of a deal. Because depending on the echo chamber that they live in on social media or on TV, they may be inclined to believe that this isn't any worse than the flu, or it's being overblown by doctors and health experts, et cetera. So the first group of people who have safety concerns, I can usually win them over, because I'll talk about how mRNA technology for vaccines has actually been around for 2 decades, and it was the same technology that was being used to try to manufacture vaccines against MERS, for example, or other outbreaks that happened in the last decade. But the difference is that those outbreaks kind of fell by the wayside, and so the vaccine production was no longer necessary. And then in the case of COVID-19, of course, this has only gotten worse and worse. It's the deadliest pandemic of our lifetimes, of multiple generations. And under President Trump, we had Operation Warp Speed, which allowed the government an unprecedented number, hundreds of millions of dollars of investment to try to get this same technology into vaccines quickly. And so that's really the difference. Is never before in human history have we had this amount of investment to develop a vaccine using technology that we already had. And so when I talk about that, and then when I talk about what the vaccine actually does inside the body, I can usually win people over when it comes to safety concerns. But I can't always win people over when we're, dealing with a different set of facts vis-a-vis, the actual severity of the disease.
Clinical trials have shown different efficacy rates for different vaccines. Also, some vaccines require 2 doses, others just 1. How should patients evaluate this information?
This is where I think the public health experts and the media didn't do as good of a job of explaining as they could have. So, when Pfizer's vaccine came to market, we heard that it was 95% effective. And so what that would mean to an ordinary person is that it's 5% ineffective, which would mean that, 5% of people in those clinical trials that got the vaccine still got sick. And that's actually not true at all. So what the 95% number means is that the vaccinated group of individuals were 95 times less likely to get COVID compared to the unvaccinated group of individuals. So actually, if you look at those trials, it was actually 0.04% of all participants in the trials who got the vaccine who actually got sick, and none of them died. And so the numbers are much more compelling than the NIH and the CDC and the FDA conveyed to the public when these vaccines came to market. And so in Moderna, same thing, that was 94% effective, or in other words, 94 times less likely to get COVID after getting that vaccine compared to somebody who doesn't. Johnson & Johnson is in the high 60%, 67%, 68%, somewhere in that ballpark. But all 3 of those vaccines are 100% effective in preventing hospitalizations and death. And that's the metric that we use, because to me, it doesn't matter. I got the vaccine, my first dose in December, my second dose in January. And for me, if I'm exposed to COVID, it doesn't matter if I get the cold or if I get a runny nose. I know that I'm not going to get sick enough where I'm going to have trouble breathing and I'm going to need to go to the hospital and potentially die. And that's really what we were trying to do, is save as many lives as possible. And if someone ends up with a runny nose, I think we all agree that that's okay.
Can you speak to the difference between FDA approved and FDA authorized, and also touch on what this emergency use authorization refers to exactly? And is this different than receiving FDA approval and or FDA authorization?
So the Emergency Use Authorization Act was passed by Congress in the wake of 9/11 to get life-saving potential treatments to the market as fast as possible in the case of a natural disaster or public health emergency. And so this legislation allows the bureaucracy to move a lot faster. I'm sure a lot of people watching this video are familiar with bureaucratic red tape. What the EUA does not do is cut corners with respect to safety. But what it does do is it allows the bureaucracy to move at a much faster rate. Again, Operation Warp Speed, where the government was able to take hundreds of millions of dollars of investment and get this vaccine to market much, much more quickly than would have happened under the traditional FDA approval process. But what I want to stress is that what they did not do is cut corners on the clinical trials. So they still had phase 1, phase 2, and phase 3 trials where they tested the vaccine on individuals, the same number or actually larger numbers than you would ordinarily see in any clinical trial for any medication or vaccine. And then based on the safety of the data that came out of those trials, then the vaccine was approved to come to market. The difference is really just how fast you can get the bureaucracy to move. And in the case of the EUA, when you're trying to mitigate a public health disaster, yes, the FDA generally has a lower bar for considering something to be most likely to help as opposed to definitely going to help. But the clinical trial data that we have from Pfizer and Moderna and Johnson & Johnson is so compelling that we know that these vaccines are certain to help. So they were able to definitely exceed the bar and the threshold to get approval.
Will the vaccine, or even could the vaccine, actually give someone COVID-19?
Absolutely not. So I answer this question multiple times a day, every day in my clinic. So let's talk about what the vaccines do briefly. So on the surface of COVID-19, on the surface of the virus itself, there's a protein. And so what the vaccine does is it exposes your body to that protein. It makes your body make copies of that protein, essentially exposing you to the protein that's on the surface of the virus. That's all it is a protein. And so what happens is then when your body is exposed to this protein for the first time, your immune system creates memory cells or antibodies so that now it will recognize that protein in the future. And then in the future, if you're exposed to the real COVID-19, your immune system will recognize the protein that's on the surface of that virus and then attack the virus because it recognizes that surface protein. And so because all the vaccines are doing is giving you a protein, it is literally scientifically impossible to get the actual COVID-19 disease from the vaccines. What you get in the aftermath of any vaccine, whether it's the COVID vaccine, whether it's the flu, whether it's tetanus or anything else, anytime you get a vaccine, the job of that vaccine is to activate your immune system to start creating those antibodies or those memory cells. And the process of activating a person's immune system causes low-grade temperature, fatigue, chills, headache, for about 24 to 48 hours, and then that subsides. And that's how you know that your immune system was actually activated. And so a lot of people will sometimes confuse the normal immune response after a vaccine with a quote unquote side effect. But those aren't actually side effects. That's just what naturally happens anytime you get any vaccine and anytime you stimulate the immune system and create an immune response.
Will the vaccine alter your DNA?
No, the vaccine cannot alter anyone's DNA. These are RNA vaccines. RNA is a very unstable thing, and it does what it needs to do in the body, and then it gets broken down instantaneously, like very, very quickly. And because RNA is so unstable, it cannot even make it to the nucleus of a cell where the DNA resides. So there's zero chance that this could alter a person's DNA.
How does the vaccine impact COVID variants that have been reported? Also, there have been reports that booster shots might eventually be needed. Could you address that, please?
Sure. So thus far, by the grace of God, all of the variants of this virus that we are aware of contain the same surface protein. And so thus far, regardless of what strain of COVID you're exposed to, if you get the vaccine, your immune system should still recognize that surface protein and attack the virus. And so it is certainly scientifically possible that the virus could evolve and mutate to the point where even the surface protein starts to change, which would render the vaccines obviously less useful. But that's even more underscoring the point that we've got to make this virus stop replicating. We've got to stop the person-to-person spread so that we can reduce the opportunity that the virus has to make new mutations that could alter that surface protein. But thus far, every variant that we're aware of still has that same surface protein. And so we do find that people who've been vaccinated have a very high degree of protection against all of these strains that are coming out.
Well, this has been an extremely informative conversation. We have been joined today by Dr. Farhan Badi, CEO and Chief Medical Officer at Carefree Medical in Lansing. Thank you, sir. We appreciate it.
Thanks so much for having me.